Welcome back to the third season of Sciton's Laser Chat Live. We're thrilled to have you with us today as we bring you yet another exciting episode featuring two nationally recognized skin experts who will share their cutting-edge techniques and treatments with all of us. Today's presentation is the latest edition of our ongoing live efforts to bring you the very latest breakthroughs in the world of lasers. Now let's meet our esteemed guest speakers who hail from the sunny Southwest, where temperatures are undoubtedly still percolating in the triple digits. So I'm sure the smiles that you're about to see on their faces are partially due to Seattle's cool temperatures. First up, please welcome Dr. Elizabeth Watwood to the stage. A dedicated naturopath, she specializes in cosmetic dermatology, anti-aging medicine, and women's health, and she's based in Phoenix. She's certified in advanced laser skincare, Botox, and dermal fillers. Needless to say, Dr. Watwood is dedicated to helping her patients look and feel their very best, both inside and out. Our second speaker is none other than Taylor Siemens, a board-certified nurse practitioner. She's based in Dallas. Taylor is renowned for her exceptional work in laser resurfacing and cosmetic injectable procedures. When she's not busy directly helping patients, she spends her time sharing her valuable techniques and knowledge by training her colleagues, just as she's going to do today. Her philosophy is straightforward. When knowledge, experiences, and passion are shared, not only does our industry improve, but patient outcomes skyrocket. Well, enough out of me. Sit back, relax, and get ready for an informative and engaging session. Welcome to Laser Chat Live.
Well, hello and welcome everybody to Laser Chat. Thank you for having this live audience in Seattle join us here today. We are both very excited to share some of our cases with you, our before and afters, and run through some different experiences that we have both had with patients.
Yeah, I'm excited. This is going to be fun.
All right, so we're just going to jump right into it. So this is one of my cases. This is a 48-year-old woman who came to me, and she'd actually been my patient before we added the M-Jewel to our practice. She, as you can see, has been struggling with both melasma and hyperpigmentation, as well as acne. So her case really got significantly worse during COVID. She works in a restaurant, and with having to wear a mask all the time, her skin did not agree with the mask. And she's a fit spy from Honduras. So, Taylor, if this was your patient, what would you choose as an option for her?
Yeah, so to me, this just right off the back looks like a really beautiful Moxie case in my hands. So something that I always kind of run through is combination therapy. I love combination treatments, the Sciton stacks whenever I can. But she's one I would be a little bit hesitant to add other treatments to. Her skin looks very angry. It looks like it's ready to react to a lot of things. And so, as I like to say, her skin has to prove to me that it can earn a combination treatment. So I would have probably started her off with a series of Moxies, planning on maybe 3 or 4. And based on how her skin responded to that, I might combine a BBL Hero the last treatment or 2, but it's one of those, her skin has to show me it can handle it. If it can't, at least I know Moxie is very safe with a lot of pre-qualifications and things that I'm sure you're going to share with us.
Yes, definitely. And she had tried a lot of things, including chemical peels and other things. And it's a good point that you brought up that her skin is angry. She's one of those that does not do good with chemical peels. And actually, I'll click onto my after. So there's her after. What we ended up doing is we did 4 Moxies that I did on a level 2, spaced over 11 months. Normally I like to do them on 4-week intervals, but she actually had a car accident after the first 2 and was not able to come in for almost like a 5-month period. Believe it or not, though, she did not have any regression from those 2. It's like we picked up where we left off. I did take a post-care from Dr. Bitter, where after doing the Moxie with my hyperpigmentation and melasma patients, I do gauze that has been in the refrigerator soaked in hypochlorous acid for about 5 to 10 minutes to really cool that skin that is, prone to PIH. And then we use a fluorinated steroid. So I use the 0.05% clobetasol 2 times a day for 48 hours. And that really helps to shut down that inflammatory process that's going to lead to a rebound pigmentation. I did put her on a 4% hydroquinone. We had to do a very small dose. She's one of those when they've tried to do higher percentages of hydroquinone in the past that she will break out in a rash or get other reactions. And then of course, in our office, one of the retinol products that I use, or it's a retinaldehyde, is the Aven triacneal. Because her acne, we had to get that under control. And it's probably one of the biggest things that I noticed about her in the second is the hyperpigmentation around the mouth from the acne outbreaks. It was like PIH on top of active acne, on top of PIH. It just was, a vicious cycle. And now she's on a maintenance program because she understands, being a melasma and PIH person, that she has to come in every 3 to 4 months and we do a Moxie.
I love that. I think it's a great example of really where Moxie fits into the practice as well. No matter the skin type, really no matter the skin issue, we can trust that our patients are going to be safe with the treatment while we continue to dive into other issues.
Yep. And that's one of the things I loved about it. When we first brought in the M-Jewel, she was one of the first patients I called because we had tried so many other things. I don't do chemical peels, but just in her history, she had tried so many other things and nothing had worked. So this was a game changer for her.
Yeah, beautiful work. You did a great job.
All right, so now I think we have your case.
Yes, so this patient here, she's 39 years old. She is Asian, so I type her as a skin type 5. She's a realtor. She's very active and on the go in the community, and she just really felt like her skin was looking pretty dull, a lot of brown spots, and she really likes to put her best foot forward. So she was really open to anything we wanted to do. She's had a lot of treatments in past with success. It was just time for that next one to get her skin back to the next level.
Good. So if this patient was to come in, complaining of some of those things, my first go-to would probably be a BBL Moxie combo, just because she's going to get that brightness. And for me, when I'm dealing with darker Fitzpatrick skin types, I like to test them now with the Moxie before I halo, although she does look like she would be a good candidate for a halo in the future.
Yeah, I think that's great. And we can pull up the after here. So I love what you were saying too about testing it out with a Moxie. That's something I think through often. She had laser treatments done in the past, so I felt pretty safe coming in with a BBL Halo combo. So we started off with a 590 filter in BBL Hero. I did about 200 pulses to the face there. I wanted to keep my heat a little bit lower just because of the risk with her skin type. And then I actually put my 11 millimeter circle on with 560, and we spot treated the rest of the browns to clinical endpoints. So I'm a really big teacher of endpoints. I think those matter a lot more than the settings you're using themselves, especially in darker skin types. And so letting her skin really dictate the settings for me was important for her. And then you can see our halo settings. So we went pretty deep to be careful with her skin type. And then I peeled her at 40 microns. And so this is about 3 weeks afterwards. She's still got a little bit of inflammation there, but overall a very nice, safe improvement for her skin type.
I mean, like you're saying, she's out and about, she's in the community. They want people to, notice how beautiful their skin is instead of being self-conscious that they're looking at them and, thinking things. So
exactly. I'm excited to see your second case.
Okay. So here's one of my lovely ladies. She actually came to intern with me, and she had a car accident. She was thrown through the windshield of a car and skid across her face on gravel. And because she had life-threatening injuries, including a broken neck, when she was in the ICU for the first 3 days, they did not remove any of the gravel from her face because they didn't know if she was going to survive. And of course, long story short, she obviously survived. Any of you who have, there's probably nobody here that did, but I loved when she interned. She had a service dog. So for a while we had a dog in our office and it was so great. He greeted everybody, he wore a tie, it was so cute. But it was her service dog from her injuries because she used to have balance issues. But anyways, she had a combination, as you can see. She has deep scarring in certain spots from where the gravel was embedded, hyperpigmentation, hypopigmentation, acne, and redness.
So before I share what I would do, I'd love to hear a little bit from you, because clearly with the hypopigmentation, sometimes it's a hard education point for our clients.
Yes.
Of, the goal is to get your skin more even, not take that away. Can you share a little bit about what that conversation looked like for her specifically?
Yes, well, I told her, luckily being that she was between a Fitzpatrick 2 and 3, that removing all of the darker pigmentation will mask the hypopigmentation, because I agree, it's not going to go away. But if we improve and even out the skin tone around it, where there's not such a large contrast between dark and light, the hypopigmentation will not appear so dramatic.
Yeah, I agree. And I think that's a really just important point. A lot of newer clinicians don't yet know how to navigate or really recognize when to have that conversation. So in my practice with her, I would love to do some combination treatments. That would probably look like, for me, combining some BBL, a micro laser peel, or the 2940 erbium with the Profractional. And so I would BBL and peel her everywhere, and then use my Profractional to really hone in on those deeper scars, try to break up some of that scarring, bring some elastin and collagen back in, and I think that would give her a really beautiful starting place, and then continue to build on that, of course, with our maintenance sessions.
Yes. Well, the amazing thing is all the treatments that we did with her were through our training courses, because she was an intern. So everything that we did was lighter than what I would have done in some cases, but still an amazing outcome. This was all done with settings that laser technicians can do and operate in the state of Arizona. So if you look at it, yes, there were 9 BBL treatments over a course of I believe like 4 years, which I feel made the biggest difference for her, just getting rid of that hyperpigmentation. We did 3 different halos, and we did 4 different Profractional treatments. And as you can see on there, the settings on the Profractional aren't as deep as I probably would have done if it was me, but we were using her as a model to let the students train. And this allowed her, in her financial situation, to be able to get all of these treatments because she was allowed to be a model in our training course. And we do love to do that, where not only was she interning with us, but she was able to receive all these treatments and make it affordable for her. So it was a big difference for her before and afters, and just, looking at the difference. Obviously, I put down there at the bottom, yes, neuromodulators and lip and cheek filler were done as well, but just the difference you can tell in the confidence in her look, and just smoothing out that pigment. And she still has some deep scars that are left. We did go as aggressive as we could in those courses, but night and day difference.
That's great. That's life-changing for someone, especially when it's, the appearance is surrounded to a traumatic event, to not have to think about that every time you look at a photo or in the mirror. So this is amazing. I would love to hear a little bit, if you can break down if any of these were combination treatments, if they were all separate, and if you would have treated her not in training, what you would have changed besides just treating deeper with Profractional.
So the halos were both combined, or all 3 were combined with BBL. Other than that, the other 6 BBLs and Profractionals were separate, just based on how we run the training courses. We do them on separate days. So those were done. But every time we did one of the halos, we did a BBL first. So those were always in combination. One of the things that I would have changed if I had been doing her Profractionals myself is the depth. I would have gone deeper in some of those scars, especially when I can change the spot size to fit around the size of the scar. We can go really deep. So instead of being at just like 180, 160, maybe 450, all the way up to 850, sometimes microns I'll go, because these were old scars. These were not new, fresh scars. Subcision is sometimes what I'll do with some of the scars when it's me treating versus my laser technicians. The one on her upper lip and in her glabella area, the before picture doesn't really do them justice for how severe they were, that I would have subcised them as well. So.
Fair enough, yeah. And that's what I love about this too is, we can see a patient in my practice, it's gonna look one way. Even looking at what your practice has done to say, well, we also could have done this, or we could have broken it up like this to save our patient more money, or if they don't have the lifestyle to be able to afford huge downtime, we still have the tools that can get our patients where they need to be based on the person in front of us. There's no cookie cutter with this, which is so important to highlight.
Yes, and the downtime, if you look at all of the treatment settings that we did, she never had more than about 5 days of downtime. And for me, that's downtime if you just kind of look bad, it doesn't feel bad. So it was very easy for her to keep functioning in her life.
Yeah, that's great.
All right, so let's see what you have next for us.
Okay, so this is a 33-year-old woman with melasma. So very similar to most melasma cases that most people are seeing. You know, they do their best to stay out of the sun, but sometimes they're not fully educated on really what triggers their melasma, or the fact that she loves hot yoga and she doesn't quite understand how that is irritating. And so we really had to take some time to do some education on melasma in general, but that was her main concern here. You can see a little bit of redness kind of associated with that to the cheek there, but overall she actually was getting married and she just wanted fresh new skin for her beach wedding, which is about 3 months after her consultation.
Okay. Well, if she was to come into my office, so you said 3 months that you have the time, still in our office, my first choice is always going to be Moxie. Just depending on how careful she was willing to be, though, because I do feel like she's got some deeper pigment there. A couple Moxies and possibly a halo in there to break that up would be my first choice. I love when they come in and they're like, I don't have downtime and I have an event and I need to be ready in 6 weeks and it has to be perfect.
Yeah, yesterday it needed to be perfect, right?
Yes, yes. Oh my goodness. But for sure, depending on how she did with the first Moxie, I would consider throwing a halo. And if not, I would probably try to squeeze 3 Moxies in before her wedding.
Great.
All right, so let's talk about what you did do.
Yes, so budget was a little bit of an issue. She was saving for a very large wedding, and so halo really didn't get to make it into our plan. And with all of the wedding planning, I mean, she already had her bridal shower and the photos and all of those things that we just really couldn't afford the halo downtime. So instead, we decided to do a BBL Moxie stack. We separated them out about 5 weeks apart, and both treatments were pretty similar. So I used BBL Hero. I love to go more off of pulse count and clinical endpoints than anything with my Hero. And then we were really able to get that pigment responding very well with just one pass of the 515. And so when I talk about clinical endpoints, I'm just meaning the pigment is responding. It's telling me it received the energy, it's darkening up a little bit. And then we combined that with Moxie level 3 as well. And so for me, just like your melasma patient, you have kind of that protocol in the treatment room to cool their skin down. I'm very similar. I have a cooling hydration mask that I put on immediately after. And our patients actually go home in them. They keep the skin up to 10 degrees cooler for about 2 hours. And so I just tell them, leave this on until the heat is gone. And then they apply that the night of treatment and the morning after treatment as well, really just to keep everything from stimulating that heat. And so the fun thing about this patient too is this after photo is actually 1.5 years later. And
really?
So that just really speaks to the power of educating your client well. So you can see here with this deep dermal melasma has really kept calm after 1.5 years, just because we took the time to educate her well, and she's committed to following those things, but we've got our Moxie in our back pocket when we're ready to touch things up.
That's amazing. Now, what kind of skincare did you do with her, or did you prescribe anything for her to go along with the treatment?
Yeah, so I will be honest with you, I'm a very lazy clinician. I don't like to deal with pharmacies, so prescriptions is usually not something that I am writing except for very severe cases. But really, it's a testament to the medical grade skincare we have in practice.
Yes.
When you have a good product in your retail line, a lot of those are going head to head with prescriptions and studies. And so we really like to put our money where our mouth is, and those are my prescriptions. And so we put her on a melanocyte inhibitor, just topical, that she's putting on twice a day. She's on a great retinol every night. She does some at-home retinol peel pads once a week. And then, of course, SPF and vitamin C forever and always. Those are kind of the non-negotiables in our practice for skincare.
Did she ever change her regimen of doing hot yoga?
No, she has not. So she actually, those cooling masks that I talked about,
yes.
she just has a stock. So every day after her yoga, she puts her mask on, and that's what she drives home in. So that's part of that education is I'm not trying to force you to change your life. If someone told me to stop what I love to do to work out, that's not going to go very well. So instead, how can we as a treatment team come around you and help figure out kind of some crutches to support the things that you want to do to keep you closer to your aesthetic goals?
I think that's so important, and that's why I wanted to ask you about that, because heat, being from Arizona, is a huge problem for us with our melasma clients. But sometimes there's things like hot yoga, or maybe they're a chef, or they have something in their lifestyle that heat is there, and you have to give them the tools to battle it. Otherwise, it's going to keep reappearing, and even though we may educate the patients and say melasma is a lifelong battle, and you have to maintain it, sometimes if it gets better and they don't maintain it and it comes back, they immediately come to you and say, well, whatever you did not work. And it's like, well, no.
Yes. I'm very notorious of kind of laying things out of like what's in my control as a practitioner and what's in my patient's control. And so we have a lot of honest conversations about that of, hey, I can only control up until here, but if XYZ happens after that's on you. So let's make sure you understand the parameters around that. And then of course, that we're not gonna wag our finger when they don't follow those things, but they know where to come to kind of get back to where they want to be.
Yep, yes, and we do the same thing with our patients. It's where your consultation is really like an education experience.
And I always say too, that's hard sometimes in our industry with the fact that everything is so transactional. When you really take it out from that and just educate the mess out of your patients, it always turns into transactions.
Yes.
It may not be that day, but it matters so much more that by the time they trust me with that money they're handing over, I can also trust them to maintain what I'm doing with those funds.
Yep. Yes, I agree. I just think that's a very impressive after for it being, you said, a year and a half out.
Year and a half, yeah.
And it's amazing that it did not come back or get worse, but she was a patient who was willing to invest the time and the effort, and that's always so important. All right, my next case, this is a gentleman who is friends with the owner of my practice, Larry. So he's a 65-year-old. He was out playing ice hockey with his nephews and slipped and fell and split his head open. And because he was in a small town in the North Midwest, there was definitely not a plastic on hand at the hospital where he was stitched up. So when he came home it was at Christmas time, he was visiting family, he immediately called Larry, which was smart on his part. Guys aren't always really good about doing that. And he called him and he said, I look like Frankenstein and I can't look like this at his job, and what can you do to help me?
First of all, I hope he earns some major brownie points with his nephews, because that's a really gnarly scar that he did with them. So, but I agree. That is really, can be a life changer when you're in the workforce and having, it's a cute story to tell with family, but as soon as you get to real life, that's not something that you want to be looking at on yourself. So for me, this is a beautiful profractional case. I love profractional for scarring, and I will, depending on, if the scar is hypertrophied or whatever it does, we mix a lot of topicals with profractional. I don't get the sense that this is super raised. How fresh is it here in this photo?
He had just had the stitches out, I want to say, within the last 7 to 10 days before he came to our office.
Okay, wonderful. So yeah, I would personally do some spot treatment with 560 on the BBL to help pull that redness out. And then if we needed that Profractional to really help with the scarring, that's what my plan of care would be.
Yep. And with this gentleman, because of his type of work, he did not have a lot of downtime either. So he's like, what can you do to help me? And the reason why I love showing this is, again, we did 4 simple treatments. Now, this is a new scar. New scars and old scars are treated completely differently in our practice. And when I was showing my car accident patient, when I was talking about having to get really deep and aggressive, that's because she had very old scars. We did 4 Profractional treatments, 150 microns, 11%, 2 passes. So he did not have a lot of downtime that he had to go through. But because he came in with such a fresh scar and we started right away, he had an unbelievable outcome. And again, keep his age in mind, right? He's 65. We all know that the older you are, the harder it is to correct things. So if they're smart and they come in right away, we can really tackle this with treatments that are easy for them to recover from, very little downtime, and have amazing results.
So really curious, in your practice, how is it that you're positioning this treatment to the patient? Is it, hey, we're going to do this Profractional and we'll do as many as we need, 4 to 6 weeks apart? Or are you and your team really trying to hone in on 3 to 4 sessions? How do you present this to the patient?
With scars, a lot of times when we do the consultation, we tell them they have to give us a year, and that it's going to take multiple treatments, and we do not hone in on a number. Because it depends on, was it a traumatic scar? How old is the traumatic scar? Was it acne scarring? Do they still have active acne going on? So a lot of times we actually throw out the give us a year to make things look really good. His was over a period of 6 months, actually, that he did this. So time is your friend as well, which is a good point that you bring that up, that we do explain to them. Sometimes we do wait a little longer between treatments, or we're just doing BBLs in between, because the body is still going to continue to work on that area once we've done the erbium Profractional in remodeling that scar. So the longer we give it, the better it's going to keep getting, even if we're doing more and more treatments in the meantime. So we've gotten into the habit over the years with things like scarring to not give a number, because I don't know. I don't know how your skin is going to respond and how this scar is going to respond. I also don't know how thick the scar is till the first time we go poking around in there.
Yeah, I love that. It's one of those questions that I get a lot from other clinicians and practices of, well, how do you know, or how do you know how to quote for this many? And I think it also honestly takes a lot of humility to just tell your patient, I don't know. There's so many factors in how this is going to respond. I can show you before and after photos of other patients with similar presentation and what theirs was, but it's really hard to just tie that number to it. And as soon as you do, it can really be discouraging for a patient if they're not on that same timeline. And so it's really saving a lot of struggle and frustration for you and your patient to give that duration of time. So I love that you all do that.
Yeah. I think the one thing that we do sell as packages right out the gate are like 4 BBLs, where if somebody comes in with sun damage, I know if I do 4 of them, there's going to be a huge difference. They may not be done yet, but I always feel like that's a safe one. But everything else, it can kind of vary what we're going to do, and we'll set a plan, but we always like to leave the ... at the end, as things will change as we get going. We may take a sharp left turn and change your plan halfway through if I find that you're responding better to one type of treatment versus another.
Sure. That's great.
So perfect. All right. And let's move on to your final case.
Yes, our last case. So this was actually a former team member of ours at Vitalik. So she's in her early 20s. She was one of our estheticians, very passionate about the industry. She was obviously born with a port wine stain. And, I'm not going to say that it was a huge bother to her. She really had accepted it at this point in her life. As a child, there were lots of surgeries and lots of lasers that they had tried. And she said there was always a very temporary response, but then it always came back. And so she was very confident with herself, but as a brand new esthetician, she had a little bit of worry if her patients maybe were not understanding that this is a birthmark and that this meant she didn't take good care of her skin.
Okay.
And so it was becoming a little bit more of a self-conscious thing. And so she's very pain adverse. Like I said, she'd had lots of surgeries and lasers on this, and so was not looking to have to shut her life down for any period of time to try and make an improvement on this.
Well, my first go-to with this would be a Clear Silk Clear V combo, because the Clear Silk can be very gentle. The biggest things when it comes to vascular with me is when they're very dark like that, it's all one giant target. And so I sometimes like to clean things up with the Clear Silk and Clear V before we put the BBL on it, because then I'm less likely to worry about blistering them. And, you know, with her too, not wanting a lot of downtime and not wanting to have a lot of pain with it, a few of the spots with the Clear V can be more sensitive if, you know, it's a giant vessel, but the Clear Silk would probably be very comfortable. So if I was starting with her, I would probably recommend doing a series of those two and bringing her in weekly for a Clear Silk. That's the nice thing about it, is you can do those stacked together. And once some of it has cleared up, using that BBL to get that final touch.
Yeah, that's great.
So why don't you tell us what you did do with her?
Yes, so I don't have Clear Silk or Clear V in my practice at the moment. And so I think that was a great stepping stone. If I had access to those, probably would have been part of my plan. But BBL is what I have. And so we just hit it here. This is after 2 treatments, about a month apart.
Wow.
We've since treated more, and it's looking much improved. She's no longer on our team, and so I don't have other progressive photos. And so after 2, this was something we were really pleased with. And so something that I really think is important to hone in on here, as you were saying, when it's dark, this is so much target. So the risk of burning and blistering is very, very high. And so you really have to take your time. This is not a rushed treatment. And it really goes back to that common theme I keep bringing up of clinical endpoints. And so we did kind of our base passes, if you will, from the Smart Start settings. And then the areas that were not yet responding, we continued to add energy to.
Okay.
So if I was already seeing that the purple was darkening or more color was coming out, we did not add any more. So we really just treated every little square inch with that square adapter on until everything was the same dark purple, cooled her skin down, and then repeated through there. And so really, even with that 11 millimeter circle adapter, we were able to get right up close to her brow there to calm that down. But her skin just overall was much happier. There was not nearly as much inflammation hiding underneath there. And she really even felt like her face as a whole was just so less inflamed, and her acne improved just because we took all of that inflammation out of there.
That is amazing for only 2 treatments.
Yeah.
Erin mentioned before kind of like having a magic wand, and that's definitely what it was for this patient. But what I always like to share at these kind of events and things too is, you know, your first 2 patients were people coming in wanting a slight improvement in their skin, but we always forget there's people out there who have issues that either are from a traumatic injury or they were born with something where they're self-conscious about it all the time. And even though she wasn't self-conscious in her normal life, feeling like she might not be a good esthetician to her patients because they would question what her skin looked like. We always say that we're the walking billboard for our services, right? In our office, when our patients come in, they're going to look at us, evaluate us, and that's, I hate to say it, but first impressions stick a little while. So it's amazing that you can take somebody like this and help them. You know, you can give them back their confidence and their strength, and it's fun.
It's so fun, you know, and she even was like, man, all of those painful surgeries I went through as a kid were for what? And they never did as much as these 2 very, 10-minute easy treatments did.
Yeah.
Where she, even from a consumer standpoint, is like, as soon as it's aggravated again, I'm willing to do this again. But she's never willing to do those aggressive surgeries that she had done in the past. And so it's really a gift of what BBL is able to take care of for us in practice.
Yes, and BBL is also a no downtime, because when patients come in for their consultation, even if they're all in ready to correct it, their top 3 questions are, does it hurt? Is there downtime? And then they're going to ask, how much does it cost?
Exactly.
But the downtime is a huge thing. And with something like this, there really isn't any downtime. Yes, they have to be careful of the sun, but you know, they don't have to take time off work. They don't have to worry what they look like when they go in the grocery store, all those things.
Exactly, exactly. Well, and even with this, with these results, I mean, with a little tinted sunscreen, she could easily cover that up fully if she wanted to. And so, yeah, BBL is just perfection for really any coloration that doesn't belong. It's a game changer.
It is. Well, and I like that you brought that point with the makeup too, because you've taken her from a pigmentation that would not be covered by normal makeup to a pigmentation that she could easily cover with makeup and nobody would know what's underneath there. Mm-hmm. Mm-hmm. That's actually how I got into the conversation with the very first melasma hyperpigmentation case that we had up there, because I would frequent the restaurant that she worked at a lot. And finally, because we always sat at the bar and she was the bartender, and she finally asked me, she's like, your skin is beautiful. She's like, I have horrible pigmentation underneath, which I could see through her makeup. Sure. You know, and I knew it was there, but I always feel bad. I don't want to go up to people I don't know and be like, by the way, I can help you.
Like, here's my card.
So I was like thinking to myself, I'm like, I'm so glad she finally asked me. And I was like, please come and see me. I will help you with your skin. And you know, you can see she still has a light color underneath that we have to, but if she has makeup on now, she looks porcelain.
Yes.
Versus before, you could see every piece of it underneath. And so it was like one of those moments where it's really fun to be able to do that and take somebody and give them back their confidence. It's just become night and day. And of course, now she sends people to me all the time, because if she gets conversations with them over the bar, she's like, I know where you need to go.
She doesn't mind bringing it up on your behalf. You just won't bring it up to them.
Exactly.
I love that.
So it's like, you know, basically she's my little marketing machine that works there for me and just sends me all kinds of patients with different things, because now that she's been to my clinic for that, she knows everything else that we do. So it's fun, you know, but it was her confidence level of giving it back, because when I first met her with that, she was still wearing a mask. We were still in that moment in time. And of course, then when she didn't have to and she was battling it, it's almost like she still wanted to wear the mask because she hated what her skin looked like underneath. And so just to give her back that confidence that, you know, every day when she's going, she's not concerned that, you know, people are staring at her.
And that's what it's all about. I think that's why we're all in the industry, to be able to bring that confidence to our patients. But
yes.
Dr. Watwood, this was so fun. You have some amazing cases. You're doing amazing work. And I really thank you for taking the time to chat with me on Laser Chat today.
Yes, thank you so much, Taylor. You have some amazing cases as well. I absolutely love this port wine stain. And this has been a great episode of Laser Chat, reviewing our photos.
Wow, what a fantastic and thorough presentation. We'd love to thank our speakers for sharing their insights and their techniques with us. And we're grateful for you. Because of your interest and your enthusiasm, our third season of Laser Chat Live has gotten off to a phenomenal start. Thanks a lot for being here. Take care, and we'll see you soon.